Hello, I am Dr. Supachok, Head of Dermatology Department at BNH. Today, I will introduce and emphasize a method of skin physical examination. It is very special. It is called a skin checkup. Believe it or not, skin cancer is the most common group of cancer diagnosed worldwide. 1 in 5 Americans will develop skin cancer by the age of 70. More than 2 people will die of skin cancer each year in the US. Getting 5 or more sunburn double the risk of melanoma. So skin checkup is very important. The main purpose of skin checkup is to prevent, search, and catch the skin abnormalities such as precancerous skin lesions early, before they turn out or transform to be skin cancers. The earlier we detect, the easier we treat, the better quality of life the patient will have. The risk factors of skin cancers are the combination of genetics and UV light exposure. But nowadays, there are a lot of bad pollutions, unhealthy lifestyle, stress, lack of regular exercise, bad food, stress, and a lot of things, such as exposure to some chemical products. Having exposure to some of these can alter the skin cells and finally transform the good cells to be the bad cells, eventually develop skin cancers. Risks are also included. Folks with blue eyes, blonde hair, getting burned easily are at higher risk of develop skin cancers. What signs and symptoms that we need to come and see a skin doctor? Any existing or new skin lesions that change in size or numbers, change of color, shape rapidly, the edge is blurred, bleeding, or any skin lesions that stay for a long time. This is not a good sign. So we advise a very simple self-skin checking at home, which you can do it every day to look after your skin. Remember this: A, B, C, D, E. So 5 letters. A, B, C, D, E. A stands for asymmetry. The mole that is asymmetrical is not a good sign. B stands for border. A mole with a blur edge or jagged edge is not a good sign. Okay? C stands for color. A mole usually have a nice and one color. If there are more color, let's say they have 2 or 3 colors, this is not a good sign, and you should be aware of that. D stands for diameter, the size. If the mole is bigger than a pencil eraser, which is about 6 millimeters, it is not good. You better be aware of and probably come to see us. E stands for evolving. If there's something wrong from A to D, let's say the shape is not good, the border is not clear, it should be clear edge. The color is not good, there are 2 to 3 colors. The size is big, then you better come to see us. You have to be aware of that. How to prepare for skin checkup? It is a very easy and simple method. You don't need to prepare anything. Just call us or make an appointment online. First, when you come, it takes about 10 to 15 minutes to obtain the physical history from the past history of skin problems, current skin condition, risks. We will assess the risk, and it takes again 10 to 15 minutes. Second part, you will see our skin doctor. That in the physical examination room, you come directly, get changed. Our doctor will come and look after your skin. Again, we look it from head to toes, thoroughly search and try to look for any skin abnormalities. We will examine all skin lesions thoroughly. Sometimes we will use the special equipment called dermoscope or special magnifying glasses that are more precise and can look more delicately than other normal cameras. If we find something wrong of your skin, we will collect photos, start to discuss about the problems, and maybe we need further investigation such as a skin biopsy for a final definite diagnosis. Again, we can start the treatment right away if we find something wrong. Usually, the whole process takes about half an hour to 1 hour. How frequent should we do skin checkup? Usually, dermatologists recommend you to do it at least once a year. But if you have history of skin cancer or any family history of skin cancers, you better come to do it every 6 months instead. But the most important thing is, if you notice any change on any existing moles or any new moles that change rapidly, bleeding, change in size or color, or find something abnormal, you have to come to see us right away. The bottom line is that skin checkup is very crucial. Again, it could be life-saving. Here at BNH, we value and promote the good health to all of our patients. Our job is to ensure that all of our patients have a safe, young, normal, healthy, good-looking skin. Similar to an annual health check, skin checkup is very important and need to be done to all of our patients at least once a year or every 6 months if you have a history or family history of skin cancers. Again, if you find something wrong of yourself, you don't wait for that. Just come to see us right away.